transfer for breast augmentation is an amazing option for women that want to go up a little bit in cup size, alter their shape a little bit, look natural and beautiful, and repurpose fat from somewhere else on their bodies. It really is a win-win situation for most patients. We do this by doing gentle liposuction, removing fat in a gentle way that is less likely to injure the cells on the way out. We place the fat wherever we want it to go, whether it's the breast or elsewhere on the body, tiny little amounts at a time, multiple trajectories, multiple different layers, so that the fat is evenly woven throughout the tissue. By doing this, you maximize the chance that those little cells get a blood vessel in the next couple days. That's what allows the fat to live and thrive. Usually about 80% of the fat that I place is gonna get a blood vessel and will be there permanently, and then you have a permanent change in the volume of that area of your body. In a consultation for fat grafting, you are gonna have lots of questions for me, I'm sure, and I have the answers for you. I'm also gonna have a lot of questions for you. This is a procedure where the most important thing is doing it on the right patients. So I need to know what your size goal is, what areas of the body you'd like to liposuction, and really what you want out of this procedure. It's very, very important that you think about these things before you come to my office. When you're here in the office, I'm gonna send you for a sizing. That's gonna give us a better idea of what you actually want out of the surgery, and then I can tell you if fat grafting is the right option for you. Recovery for a fat grafting procedure, for the most part, is actually pretty easy. The two things that are really annoying in the post-op period, number one, wearing your garment. You have to wear a Spanx on the areas that are liposuctioned. They help the skin shrink in nice and smooth and give you a nice uniform contour in the areas the fat was taken. The other annoying thing is that you need to be on a high-carb diet. Most people this isn't annoying, but sometimes it is if you have a diet that you really, really love that's lower carb. We really don't know why, but patients on low-carb diet have a lower take of their fat. We want to get at least 80% of those fat cells a blood vessel so they live and thrive and they're there permanently. If you are on a low-carb diet, that will fall, sometimes closer to 50%. Just not acceptable. Do the high carb diet for a couple weeks after surgery and it's gonna maximize how much of that fat lives.